Welcome back to Learn with Professor Janula. If you're a nursing student, this channel is just for you. Don't forget to subscribe and hit the bell icon. Today we're learning about changes in the respiratory system during pregnancy. So go ahead, subscribe, and let's get started. Have you ever noticed that pregnant women may breathe a little differently as pregnancy progresses? This happens because the body needs to supply oxygen not only to the mother but also to the growing baby. To meet these increased oxygen demands, the respiratory system undergoes several changes. These changes begin early in pregnancy and become more noticeable as the baby grows, helping both the mother and the fetus get the oxygen they need for healthy development. Now, let us look at an overview of how the respiratory system adapts during pregnancy and why these changes are important. First, the respiratory system adapts to meet the increased oxygen needs of the mother. As pregnancy progresses, the mother's body works harder to support both her own needs and those of the growing baby, so more oxygen is required. Second, these changes help ensure that the fetus receives an adequate supply of oxygen. Since the baby depends entirely on the mother for oxygen, efficient oxygen transfer is essential for normal growth and development. Third, the respiratory system helps remove carbon dioxide produced by both the mother and the fetus. This is important because carbon dioxide is a waste product that must be eliminated to maintain normal body function. Finally, these adaptations help maintain acid-base balance in the body. In simple terms, they keep the body's internal environment stable, which is important for the health of both the mother and the baby. So, overall, respiratory adaptations during pregnancy help provide more oxygen, remove waste gases efficiently, and maintain a healthy balance within the body. Now, let's discuss the anatomical change that occurs in the respiratory system during pregnancy. As pregnancy progresses, the uterus gradually enlarges to accommodate the growing baby. Because of this increase in size, the uterus pushes the diaphragm upward. By the end of pregnancy, the diaphragm is elevated by about 4 centimeters. You might think that moving the diaphragm upward would make breathing difficult. However, the body adapts very well, and the diaphragm continues to move effectively during breathing. This ensures that adequate ventilation is maintained throughout pregnancy. Now, why is this change important? First, the upward movement of the diaphragm creates space for the enlarged uterus within the abdominal cavity. Second, some pregnant women may experience a feeling of shortness of breath or breathlessness, especially during the later months of pregnancy. This occurs partly because of the elevated diaphragm and the increased oxygen demands of pregnancy. Now, let's move on to another important anatomical change during pregnancy: expansion of the thoracic cage, or the chest wall. As pregnancy progresses, hormones such as relaxin and progesterone cause the ligaments and joints around the rib cage to become more flexible. Because of this, the rib cage gradually widens and expands outward. One noticeable change is that the subcostal angle, which is the angle formed below the ribs, increases from about 68 degrees to around 103 degrees. At the same time, the chest circumference increases by approximately 5 to 7 centimeters. Now you may wonder why this happens. As we discussed earlier, the growing uterus pushes the diaphragm upward. To compensate for this upward movement, the chest expands outward. This adaptation helps create enough space for the lungs to function properly. As a result, even though the diaphragm is elevated, lung expansion is maintained, and the mother can continue to meet the increased oxygen demands of pregnancy. Now, let's move on to the physiological changes that occur during pregnancy. The first change is increased oxygen consumption. During pregnancy, the mother's body needs more oxygen than usual. In fact, oxygen consumption increases by about 20 to 30%. Why does this happen? First, the growing fetus needs a constant supply of oxygen for growth and development. The placenta is also very active and requires oxygen to support the exchange of nutrients and gases between the mother and the baby. Second, the mother's metabolic activity increases during pregnancy. Her body is working harder to support the pregnancy, produce more blood, and meet the needs of the developing fetus. All of these processes require additional oxygen. Why is this important? This increase in oxygen consumption ensures that both the mother and the fetus receive an adequate oxygen supply. It helps support normal fetal growth while also meeting the increased demands of the mother's body. Now, let's discuss another important physiological change during pregnancy, known as hyperventilation of pregnancy. During pregnancy, the level of the hormone progesterone increases. This hormone stimulates the respiratory center in the brain, causing the mother to breathe more deeply and slightly faster than usual. What happens because of this? First, alveolar ventilation increases. This means more fresh air reaches the alveoli, the tiny air sacs in the lungs, where oxygen and carbon dioxide are exchanged. Second, oxygen uptake increases. Because more air reaches the lungs, more oxygen enters the bloodstream. This helps meet the increased oxygen needs of both the mother and the growing baby. Third, carbon dioxide elimination increases. A mother breathes out carbon dioxide more efficiently, helping remove waste gases produced by both the mother and the fetus. Now that we have discussed the physiological changes, let's look at their overall effects on breathing during pregnancy. First, breathing becomes deeper. Pregnant women take deeper breaths so that more oxygen can enter the lungs and reach both the mother and the baby. Second, as the uterus grows, it pushes the diaphragm upward. This slightly reduces some lung volumes, but the body compensates through other adaptations, such as expansion of the chest wall. Third, more oxygen is needed and used during pregnancy. This is because both the mother and the growing fetus require a continuous supply of oxygen for normal functioning and development. Fourth, carbon dioxide levels decrease. Since pregnant women breathe more efficiently, carbon dioxide is removed from the body more effectively, helping maintain a healthy environment for the fetus. Finally, many pregnant women experience mild breathlessness, especially during the second and third trimesters. This is a normal finding and occurs because of increased oxygen demand and the anatomical changes taking place in the chest and lungs. Now, let's look at how blood gases change during pregnancy. First, the level of oxygen in the mother's blood, known as PaO₂, increases slightly. This helps ensure that more oxygen is available for transfer to the fetus, supporting its growth and development. Second, the level of carbon dioxide in the mother's blood, known as PaCO₂, decreases to about 30 millimeters mercury. This happens because pregnant women breathe more deeply and efficiently, a process known as hyperventilation. Third, because carbon dioxide levels decrease, pregnancy produces a mild compensated respiratory alkalosis. In simple terms, the blood becomes slightly more alkaline, but the body quickly adjusts to keep everything balanced. Fourth, the kidneys help maintain this balance by excreting more bicarbonate. This compensatory mechanism prevents excessive changes in blood pH and helps maintain a stable internal environment. Finally, these blood gas changes make it easier for carbon dioxide to move from the fetus into the mother's blood, where it can be removed through the mother's lungs. This helps the fetus eliminate waste products efficiently. Now, let's discuss dyspnea of pregnancy, which is more common during pregnancy. Dyspnea simply means a feeling of shortness of breath, or the sensation that breathing requires more effort than usual. This is experienced by about 60 to 75% of pregnant women, making it one of the most common respiratory complaints during pregnancy. Why does it occur? The main reason is the increased level of progesterone during pregnancy. Progesterone stimulates the respiratory center in the brain, causing the mother to breathe more deeply. As a result, many women become more aware of their breathing and may feel slightly short of breath. When is it most common? Dyspnea is usually mild and is most commonly noticed during the second and third trimesters, when the baby's growth and the body's oxygen demands increase further. An important point to remember is that this type of breathlessness is a normal physiological adaptation of pregnancy. It is not usually associated with hypoxia, which means the mother and baby are still receiving adequate oxygen. Now, let's summarize the major mechanical changes that occur in the respiratory system during pregnancy. First, as the uterus enlarges, it pushes the diaphragm upward by about 4 centimeters. This is a normal adaptation that creates space for the growing baby. Second, the rib cage expands, causing an increase in chest circumference. This helps compensate for the upward movement of the diaphragm and allows the lungs to continue functioning effectively. Third, the subcostal angle widens because pregnancy hormones relax the ligaments and joints of the chest wall. This makes the chest more flexible and able to expand outward. What is the effect of these changes? These adaptations alter the normal mechanics of breathing and may contribute to the feeling of mild breathlessness that many pregnant women experience. However, an important point to remember is that despite all these structural changes, respiratory function is generally well maintained throughout pregnancy. The body adapts remarkably well to meet the increased oxygen needs of both the mother and the fetus. That's the end of this video. If you liked this video, don't forget to like, share, and subscribe to my channel for more nursing learning videos. Thank you for watching, and keep learning.